We're going to show a test of the shoulder area, which reacts similar to the pelvic area, and can show us if the body is in stress and what kind of stress we have. So as our friend is a dentist, he can use it also in his daily practice. So you come over, please, and then show where I put my finger. We have the scapula here. And I put my finger outside the scapula and lift the arm, and now the scapula is coming. My finger is moving, so we have about 90 degrees abduction. And on this side, we have about 110 degrees. Okay, so there's a difference in both shoulders. You touch your navel with the left finger, inside the navel, please. And then we see the shoulder opens until 100, 130, 140 degrees, and we change the other side. Not really so much, but it opens on the right side. So we check now the throat area. It doesn't open really. So the throat area is somehow blocked, and also the navel is not really able to give a complete relaxation. We want to check the dentist area, which is interesting for you in your work. Just touch your tooth. So we have some problems in this area too. And you touch the other side, because when you touch them, you have more movement. Now we have much more movement. So the right teeth are connected somehow with the tension in this area, and we want to find out which of your teeth is the main problem. So you start walking from up there downward. So that might be a problem teeth. Next one. This knot. The next one. This knot. No. No. So probably something is around here. Do you know something about this teeth?
That's the area where wisdom teeth was. Maybe there's some infection in the bone where the wisdom teeth was.
Okay, so
but the tooth in front of it, the seventh on the side, I don't know that there's a problem. The other one is extracted, and there's a ceramic implant in it.
So probably there's something here, and you should check that. Okay, and we could also do that with the other teeth, but we want to check something else. We want to check if the position of your chin has some influence on the ANS. So now you move very softly your chin leftward. No, that's not bad. And now you move it rightward. No. So the position of your chin is more to the left. So when you do your exercise, can you lay down again? Just as exercise you can do from time to time. Move your chin leftward and connect it with the navel. Okay, very, very softly. And to relax the other side, you just hold the left area without shifting it, just very softly holding it. Okay. And afterwards you can hold both chin areas in the face and hold it very, very softly in the direction which you feel is more comfortable. And just hold this position for a couple of minutes. And we can also check, you can stop that now as we're not going too deep. We want to keep some stress for our exercises. So you want to check if your glasses are doing some stress. There's some tension here. Can you leave your glasses, please? and you have less stress now. So I would recommend you, though these are very beautiful glasses, somehow to find some glasses with have an interruption here. If there's a connection between the right and the left side with metal, that gives a connection with the two hemispheres of the brain.
Okay.
Which is not so relaxation, that gives some kind of stress for the body.
Okay, just a question. Is it similar to the retainer on the teeth?
Yes, yes.
If I got my glasses on,
So
okay.
you can ask your optical if you can put something inside, or the next time you buy some glasses, you buy them not with metal but with some kind of plastic.
Okay.
Okay?
Fine. Okay.
And you want to check something else. Now the body is for a moment relaxed, but the stress comes back because you still have some stress in your system. And so, no, but it's a little more relaxed now. The glasses seem to give a real problem, which should consider. But there's still enough stress so that you can test your eyes now. You put your hands on your eyes. Okay, so your eyes are also tired. Yes? When you relax your eyes with your arms, that gives a direct relaxation for the ANS. And so I recommend my patients, and I do it myself as well, when I come back home and do my relaxation, I start with this exercise. Just only put my hands on the eyes and hold it for a minute or two, and the system gets into a relaxation. Sometimes also we need to relax the aura of the eyes. And the same is with the ears. We can test the ears and we can test the aura of the ears. And the same we can do with other joints, key joints. I call them key joints because they are key to the ANS. So well, you're getting more and more relaxed. But there's still a little tension that we can use for our test. Okay. Now we test the atlantoaxial area with our atlas joint. No, it doesn't really change. So we can say this area is not a key for the test, for the stress in your system. It might be there's some problem there, but it's not a problem that makes the tension the ANS. And now we test the lower part of the spine. Put your fingers to the coccyx area. No, it's also, it might be there's some problem, but there's not a key problem. Okay, we test also this area of the sternum and the ribs. Yeah, yes, here we have some problems. These ribs always are one main storage for emotions. That's why we say I have a burn on my heart. It probably comes from the ribs, especially the third and the fourth rib on the right side. Often store emotions from longer times ago and have a connection to the upper part of the spine and also to the lower part of the spine and also to the area of the teeth. So later we will try to show how we can work on that. Thank you.
Thank you.